Today, we are going to talk about a serious and important topic: depression. If you or someone you know is going through this, know that you are not alone. Your life matters, and we are here to help. Welcome to the Yellow September channel. Depression is one of the most complex and misunderstood conditions of our time. It goes beyond a simple feeling of sadness or discouragement. It is a serious mental illness that can affect all aspects of a person's life, from the way they think, feel, and act, to the way they interact with the world around them. Unlike a momentary sadness that may arise after a specific event, such as the loss of a loved one or a disappointment, depression is persistent. It can last for weeks, months, or even years, and its intensity can range from mild to extremely severe. Often, the person suffering from depression feels a deep emptiness, a lack of purpose, and a loss of interest in activities that once brought them joy. The impact of depression goes beyond emotions. It can also manifest physically, with symptoms such as insomnia or excessive sleep, constant fatigue, unexplained aches and pains, and significant changes in appetite. These changes can further worsen the person's emotional state, creating a vicious cycle that is difficult to break. Despite being a common condition, many people still find it difficult to talk about depression. The stigma surrounding mental health causes many to suffer in silence, without seeking the necessary help. This lack of understanding and acceptance can lead to isolation, guilt, and in extreme cases, suicidal thoughts. Understanding depression is the first step to combating it. It is essential to recognize that it is a disease like any other that requires treatment and support. And most importantly, it is crucial to remember that with the right help, recovery is possible. If you are facing depression or know someone who is, keep watching. Here on Yellow September, our goal is to shine a light on those in darkness. Together, we will explore the causes, symptoms, and possible solutions for this disease, always with the hope that each video can bring a little light into your life. Depression is one of the most prevalent mental illnesses in the world, affecting people of all ages, genders, and backgrounds. According to data from the World Health Organization, more than 300 million people worldwide suffer from depression. This number makes depression the leading cause of disability globally. Moreover, depression is strongly associated with the risk of suicide. It is estimated that approximately 800,000 people die by suicide each year, which represents one death every 40 seconds. The WHO highlights that for every case of suicide, there are many more cases of attempted suicide, which can be prevented with adequate support. Research indicates that 50% of people suffering from depression do not receive proper treatment, further aggravating the situation. Science also gives us a deeper understanding of the biological mechanisms involved in depression. Studies show that depression may be linked to chemical imbalances in the brain, particularly in neurotransmitters like serotonin and dopamine. Neuroimaging studies have shown that people with depression exhibit changes in specific areas of the brain, such as the hippocampus, amygdala, and prefrontal cortex, regions involved in regulating emotions and responding to stress. Science also indicates that genetic factors can increase the risk of depression, especially if there is a family history of the disease. Another important point is the environmental and psychological risk factors. Chronic stress, childhood trauma, domestic violence, and situations of high social or professional pressure are known potential triggers for depression. These factors, when combined with a biological predisposition, can further exacerbate the condition. Science continues to evolve in understanding depression, but one thing is clear: it is a treatable condition. With proper diagnosis and treatment, millions of people worldwide can live full and productive lives, despite the challenge that depression represents. Psychologists emphasize the importance of identifying and treating negative thoughts and behavioral patterns that can perpetuate depression. They often use approaches such as cognitive behavioral therapy, CBT, which helps patients develop skills to deal with distorted thoughts and to face difficult situations more effectively. Psychiatrists, on the other hand, focus on the importance of addressing the biological aspects of depression. They explain that in many cases, treatment with antidepressant medication is necessary to help balance neurotransmitters in the brain. However, they stress that medication should be accompanied by therapy, so the patient receives a more complete and effective treatment. Both groups of specialists agree that emotional support is crucial for recovery. Group therapy, support from friends and family, and creating a support network are often mentioned as essential components to help someone overcome depression. Additionally, specialists encourage people suffering from this condition to seek help and not feel ashamed of seeking treatment. Recovery is possible, and with the right support, many people can regain their lives with quality and hope. The main message from the experts is clear: depression should not be faced alone. And remember, depression does not define who you are. You are much more than that. Each day is a new opportunity to seek help, to fight, and to allow yourself to be happy. It may be difficult now, but the path to recovery exists, and you can walk that path. Your life matters. If you like this video and think it could help others, don't forget to subscribe and share the Yellow September channel. Together, we can make a difference.